already I declared for interesting role with the pediatric program challenges. So again, nearly same as in the basic pediatric also we have two pathways there, MD pediatrics and diploma in child health, postgraduate diploma in child health. And the main one is MD, sort of medicine and hospital pediatric. So nearly same as the MD to enter the training program, you will have a selected examinations. There are two exams, 6 months apart. So the eligibility criteria again, you must satisfy. You have to have a medical duty registered in the Sri Lanka Medical Council, and you have to complete the internship, and you have to complete the 1 year of post internship at the time of application. So the selection examination consists the conducted area is the basic and applied science, pediatric and the child preventive and the curative aspects. The component of the examination is two components. There's a multiple choice questions, same as yours, and the objective answer. It's the physical examination, really same as our professorial appointment process. So, multiple choice questions, 3 hours, 180 minutes, 60 questions. There are two parts, part 1 and part 2. Part 1 is 30 questions, true false, and you will get 5 marks for one question, and you will get 150. And part 2 is 30 questions, single best answer, and you will get 90 marks is correct. And you should get each part. You can't compensate like your final DVS. You have to get each at least 45%. And you have to get more than 50 to go for the post. So in final you can compensate, you can get true false less or single best less. And you can get only the complete 50. Here you have to get at least 45% in both components, and then get more than 50 to qualify for the OSCE. To qualify in the selection examination only, then you will go theory only, you will go for the OSCE. In OSCE there will be a 15 station. One is we have 10 stations, here it is a 15 station, and there will be a 5 live stations. So you have 6 live stations in our one. Here 5 live stations. The 5 live stations will be 10 minutes each. And there are 7 minutes for the exams, like your short cases, 7 minutes for you to do the cases, and 3 minutes for the marking. And the rest ones are 5 minutes, like our OSCE station, the data and other things. And the OSCE will be marked for the 100 for each, and you will get 1,500 marks. And to qualify for that, you have to get at least more than 45 in the part 1, more than 45 in the part 2, 6 in the test 4, and then altogether you have to get more than 50 in the HCQ component, and then you have to get more than 50 in the OSCE component. For that, you have to get at least more than 50 in the 8 stations. You can't get 100 is you, and you can't fail the 0. So you have to get at least 8 stations, you have to get more than 50. In which at least 3 live stations you have to get more than 50. So that criteria you should be fulfilled, and you have to get average more than 50. And then even if you get more than 50 and the total is more than 50, the number which how many number you can get through is decided by the Ministry of Health. And depending on the need of the pediatricians in the Sri Lanka. So it's nearly, these days, it's nearly 24 to 30. So in the island, they will take for one exam, they will take nearly 24 to 30. So even sometimes if the more than 24 numbers is taking about 50, depending on the merit, they will take only the 24. So that's depending on the things they will take, depending on the need, they will take only the number is decided by the ministry. So it will be the mark component. It's right from the MCQ part 25 marks, MCQ part 25, and those two components directly takes the answer. Then once you qualify the selection examination, then you will go through the training part. So training is, there are 3 stages that you will be as a registrar, you will be doing. Stage 1 is in the teaching hospital, that is 1 year, mainly the general pediatrics, and we will have a pediatric intensive care one. And stage 2 is in the medical hospital, and stage 3 is in the LRH only. And then we will sit for the main MD examination. This is after 3 years of training, we will sit for the MD examination. So that component is having theory component, 4 components, and the clinical slow case and short case. I am not going in detail in the exam. If you are more interested, you can see from the PGIM Pediatrics Prospectus 2022. So after the exam is over, then you will be posted as a senior registrar, and that's stage 4 local training, post-MD local training, and then you have to go for a overseas training. So this local training and overseas training, before that you can select this whether you are going to do the general pediatric or subspecialties. There are several subspecialties: neurology, neonatology, cardiology, nephrology, intensive care, endocrinology, pulmonology, and community pediatrics and clinical genetics. Again, is the number of each subspecialty will be decided by the need during that year, and you will choose the subspecialty depending on the merit position in that. So you will decide on that place after the part 2 exam, and then the local training and the overseas training is between 1.5 to 2 years if varies. So you will finish your local training and the overseas training. So when you have completed local and the overseas training, there will be a pre-board certification assessment where you have to complete all your training, and you have to do a research project, and you have to complete your portfolio similar to your undergraduate everything, and then you have to give your satisfactory progression report, and there will be a pre-board certification assessment, and then you will be board certified as a consultant pediatrician or specialist in the pediatrics. So that is for the MD pediatrics part. Little bit for the postgraduate diploma in childcare. So it is just to give a knowledge for a medical officers to get in the pediatrics. So it will not leave after getting a postgraduate diploma. It won't be qualified as a specialist in pediatrics, and it will not give any lateral entry for the MD pediatrics, but it will give, as in the other case, the great promotion for the medical officers from the state bar. So again, there is a selection examination. So again, same the selection examination is criteria, eligible criteria is same as FG. 1 year. 14 years in this necessary. Contents area is nearly same, but the depth is really less. It is not necessary to study as depth as the pediatrics. So assessment is MCQ 2 papers, part 1 and part 2. Only 50 questions, like 100 yes, 20 true false and 30 questions. So it will depends on the 100 marks. And then there will be a training programs. There will be a 3-month of the pediatric training programs. There is a second on board and a supervision and the pediatrics one. And there will be workshops and day-based programs. So it's necessary for the 100% attendance. And then you will sit for this exams. So the exam will contain written papers, short answer questions, and the structured questions, and the clinical components nearly same as your long case and short cases. There is this contain one communication, one developmental assessment, and 2 short cases. So nearly similar to your finally, yes, and you have to got 50% you satisfied for that clinical comfort. So, doing a pediatrics is always, if you are
Before challenges, why you selected the
yes,
clinic?
that's right. I'm telling you.
Okay.
So the thing of pediatrics is, if you are making a baby to survive, you are making 100 years of life happy. So if you are a baby who is a neonate, who is not sized with dyslexia, you are making a baby, not going to hypoxia, not making a baby to without going into cerebral palsy, a birth of making a community good education, educate us, and good work. So 100 years, 70 years of life, you are making a baby to be a healthy child. So that's when a child is coming with ill and a meningitis, ill child, and you can see when they are going a happy smile. That is enjoyable life you may have enjoyed when you are doing the pediatrics. That is the happiness you can see at any time. So that is a very enjoyable job. You can enjoy when you are doing the pediatrics. So even though there are few challenges, you can see that is always enjoyable. So always you can see that the mothers are always stressed when the baby is ill, even for a month illness. Even a small things you can very easily make them happy and enjoy. So this is a very important. There is a lot of vacancies in the medical hospitals. Our community need enough pediatricians to improve the health of the children. So there are enough vacancies. You can get and make a the community better. So there are few challenges. Emotional strain. So sometimes we may get when a baby is ill or sometimes when they die, we may also, our emotions are go down and we may be upset on that day. So that you may have to go through with that and you may have to go with that life. So you have to accept that part. That is one of the challenges. And the long hours of teaching and ongoing. Or even the small things. You can't wait. You can't come and class little later or like that because they will be. You may have 10 hours during that appointments. They will quickly deteriorate. So that you have to attend them and they are, even if you are a consultant, you may have to attend them and they are quickly. So that is, you may have to be ready whenever you are available. So that is, you have to compromise your life, or you have to be ready. So when you are choosing, you have to think whether I'm suitable for that, whether my family will allow for that to work. So you have to decide for choosing your life. So there are some limited training slots. So that is our limitations. The government will give only if it is 24. That's 24 only. So you should be in the top 24 if you have to be selected. So you should be in the island, you should be in the top 24 each time. So otherwise you have to sit for the next time to get in the top 24. So that is our limitation. And just a lengthy training. So it's same for everywhere, but it's nearly 6 years of training in the postgraduate if you committed. So you have to be, then you can't drop out in the halfway and go for the some other places. If you committed, you have to be committed for the long, lengthy training of 6 years. So these are the few drawbacks if you go for. Otherwise, it's a happy, enjoyable throughout your life. Thank you.